Hello everyone, I am Dr. Priyank Patel. I am a consultant spine surgeon in the city of Mumbai and I am part of this practice group called as VR Spine. Today I am going to talk to you guys about the different innovations that have happened in spine surgery over the past couple of decades. Well, spine itself is a very young branch. Like 30 years back was the time when the first spine unit was actually set up in the country. So that is how new this branch is. Over the past 30, 40 years, there have been several advances that have happened in the field of spine surgery, which has made these surgeries more predictable with very good outcomes and much more safer than what they were in the previous decades. Uh, the different innovations that have happened are to protect the nerves, to improve the access for surgery, the newer techniques that have been developed, and the newer instrumentations that have come up, which makes the spine stronger. The biggest fear that patients have in spine surgery is the risk of paralysis. Well, to negate that, there is something called as intraoperative neuromonitoring. So, in good old days, what used to happen is up until the surgery is done and the patient wakes up, there was no way for a doctor to know if there was any kind of damage to the nerves or if the nerves are getting bothered. And if something like that is happening at the time of surgery, the surgeon would not know, and only after the patient came out of anesthesia would they realize that the legs and all are not moving. Well, those are the disastrous complications of spine surgery because of which people are afraid of doing it. In today's day and era, that does not happen. Why it does not happen is because there is now something called as intraoperative neuromonitoring. In intraoperative neuromonitoring, what happens is that the signal from the brain is sent along the spine and it's collected in your hands and in your legs. And at the time of surgery, if there is any botherance of the nerve or the nerve is getting damaged or irritated, immediately the machine is going to beep and the technician will tell you to stop the surgery, and you can take corrective action at that same time. So that single innovation has completely changed the safety of spine surgery. The other things that have gotten better is that now there is improved access. Initially, let's say if I had to do this much, I had to do a surgery in the spine, and if this is the model of the spine, this is where your skin is, this is where your spine is. In order to reach the spine, I had to open up the skin so much. So after opening up the skin so much, you open up the muscles and you go here. Now with the advent of microscopes, we don't have to open up the spine so much. We can just open up the spine this much and we'll be able to see the same thing that we would see from here. So the amount of tissue damage significantly reduces. Along with microscopes, you have other added equipments like a endoscope or a tube, which helps access better. And if access is better, two things happen. One is the surgery is quicker, faster, and uh, the amount of tissue that we need to open up to reach that place becomes less. So that is the second most important thing that has developed over the past couple of decades. The third thing that has happened is the skill set. As I told you, 30, 40 years back, we had orthopedic surgeons who used to do few spine surgeries. Over the past couple of decades, these orthopedic surgeons have gotten more trained, and eventually they have become, and there are of course neurosurgeons who have become more trained, and now there's a subspecialty called as spine surgeons. These are orthopedic surgeons and neurosurgeons who exclusively practice spine, since they are better trained and they are doing only spine surgery. Of course the expertise gets better and the so-called complicated procedures appear very simple for them because they are doing that day in day out. The other thing that has also gotten better is the instrumentations. So in order to make the spine strong, we sometimes need to put in screws. uh, Over the past decades, these screws have become better quality. From stainless steel, we have moved to titanium, we have moved to cobalt chromium. The screws initially, where we were not able to put in old individuals, now we are able to put in even old individuals because they are better quality. They come with assistance of bone cement. So even if the patient is very old, osteoporotic, with the help of bone cements, you are able to put all these things. Uh, Also, now there are added instrumentations which help us put the screw in the spine without actually opening it. So again, earlier, if I had to put the screw in this bone, I had to open up everything and then I had to put the screw in here. Now we don't need to do that. Now we are able to put the screw without actually opening up the skin by just putting in a wire over that the screws are threaded, and that is called as minimally invasive spine surgery. Earlier, after putting the screws and all, we had to get the patient out of anesthesia, send the patient into the x-ray room, get the x-rays done. uh, if x-ray was not very good, we used to do CT scans. Now we have CT machines available in the operation theater. So as soon as the screws are put, we can quickly check if the placement of screws are good. In complicated spines, spines like scoliosis, kyphosis, tumors where the spine is destroyed, or there's a very crooked, very bad, anomalous spine. There we now even have robotic assistance where a robotic arm can help guide you put screws in those difficult areas. So as technology is going improving and things are getting better and better, the spine surgery is becoming safer. We are able to do so many more things which we couldn't have imagined doing 10 years back. So these are few innovations which have really changed the face of spine surgery. uh, if you have any queries regarding any of these, you can message us and we'll be happy to help you guys. Thank you very much.